All right, let's get back to some health news. The time now is 10:38. Earlier in the hour, we told you that it is Newborn Screening Awareness Month. We've got this topic on just in time, the last day of September. So we're talking about these screenings that save in some cases and in other cases dramatically improve the lives of more than 12,000 babies every year. So joining us to add more context to all of this is Brianne Westmore, who is the Director of Maternal Child Health and Government Affairs for March of Dimes, Arizona. Your title in itself is a mouthful, Brianne, so we know that you know what you're talking about. Just for the basics, I mean, how critical are these screenings?
Newborn screening is absolutely the most important thing we can do as soon as a baby's born.
Okay.
It's baby's first test, and it's an interconnected public health system that really can let parents know what's going on for something that they can't initially see with their eye, but it really helps understand what is going on with that baby.
And in some cases, it's going to lead to immediate treatment and intervention right away. In other cases, even it might allow a family to be eligible for benefits and other services down the road that they may not have otherwise been aware of, right?
Correct. So Arizona currently tests for 31 out of 35 core conditions.
Okay.
And if one of those conditions is caught, we have a fantastic team at the Department of Health State Lab that will do immediate follow-up with those families and help them get into treatment and referrals.
So I know a lot of thought when people are planning, where am I going to deliver and where's my doctor and all of this. You know, you're thinking within your own city, of course, based on the amenities maybe of a hospital. All of the hospitals test for the exact same thing in Arizona, but it's hard to understand why it would be different state to state.
So each state elects on which conditions they're going to add to their newborn screening panel. The federal government does recommend the 35, and Arizona, as I said, does 31. We're looking to add 2 more tests this year to really reach around and collect all those families that we have treatment and tests for them available, and we really want every baby to be able to get that.
So one of the things that March of Dimes does is really advocacy in arenas like this, where you've got the expertise and you're working in connection with the state and local governments. So how has the partnership been moving forward? I know that Governor Ducey said that this was something they wanted to focus on.
Governor Ducey and his office have been wonderful in this process. In 2017, he allowed us to add SCID to the newborn screening panel, and a couple years before that, we added CCHD. So they have been very supportive of our efforts, and we look forward to working with them and the Department of Health as we move forward to look at how can we best advocate for those families with the 2 conditions who are not currently on the panel.
And what is it that gets in the way? Is it funding?
It's funding. So anybody who is most passionate about it really should contact their representative and tell them how important this test is and how important the interconnected public health system is to allow for these families to have their best shot at life.
April recently did a story with a family, and I told you about the little girl, and it was one of the conditions not screened for, and so she had kind of a delay in the treatment and lost a lot of her muscle development in the meantime. It was SMA, I think?
SMA.
Yes.
Yes, so if it's not immediately caught, there can be life-altering complications, which is why we really want to get those babies tested between the hours of 24 hours and 48, so really the families can start on a path for treatment and more education.
More broadly with the March of Dimes, I mean, many people think of March of Dimes, they think of prematurity awareness. There are so many levels to what the March of Dimes is doing to advocate for healthy moms and strong babies, and this is just one issue that you're touching on in your work, right?
Yes, this is one of the many issues. March of Dimes, we advocate for the health of all moms and babies, and within sight of that there are many different elements that keep mom healthy and baby healthy, and we touch all of those, and we're excited to work on newborn screening this year and really get all of those families into care.
And as Michelle said earlier when she was telling her own personal story about her daughter, and you know, it's so raw even 17 years later, really ask the questions, really make sure that you understand those results, right?
Absolutely. It's one of the best things that you can educate yourself on, and so empowering for a new mom as her story that keep advocating for you and your baby, and it will lead you to success.
Brianne, how can March of Dimes be a resource for the rest of us, or how can we support the efforts?
Absolutely, go to marchofdimes.org, and you can get in touch with the state chapter, and we are here to answer any questions, be a liaison, and help you advocate for healthy moms and babies.
Thank you so much for your work.
Thank
and we're
you.
looking forward to, of course, continuing to partner with March of Dimes and looking all the way ahead to our March for Babies in the spring, April 18th, right, of 2020.
Yes.
We will be there, and we hope that you will lace up your sneakers and join us as well. Thank you.
Thank you.